I recently made a video on how dementia often goes undiagnosed in the hospitals. And it's really interesting that there's studies out there that are showing that so many patients in the hospital that go undiagnosed on a daily basis. And a lot of the times it's doctors that are missing these simple signs. And the reason is because a lot of them just don't do these assessments. So in this video, I'm going to talk about the stages of dementia. There are actually 7 stages of dementia, and this can be a little bit confusing, but what you can do is you actually can break those stages up into 3 stages altogether. So stage number 1 is just going to be mild dementia, mild cognitive impairment. Now, this is just going to be where you might lose your keys, you might just kind of forget things. My wife would probably say that I have this stage of dementia because I'm always losing my keys, I'm always losing things. When I go to work, I just forget things that I should have with me. In this stage, people are starting to miss appointments more. They might be misplacing things, but they can still do their everyday activities. They can get up in the morning, they can cook for themselves, they can bathe themselves, they can even drive. A lot of people think that once you have dementia, you can't drive anymore. That is often a misconception. You can still drive with mild dementia or a mild cognitive impairment. The problem is once you start moving to this moderate stage, that's when you probably want to start taking the keys away. And the mild stage can last like around 7 years. So someone with mild dementia can still be driving for up to possibly 7 years. Once you start noticing that they're starting to have more impairments, they start to get to this moderate level, which is stage 2, that's when you want to take the keys away, because moderate dementia is when people start having more difficulty with problem solving and executive functioning. They may have a change in like their visual spatial skills. Moderate dementia is when they're going to start needing close supervision. So you want to make sure that someone is at home with the individual at all times. If they're cooking a meal, they may walk away from the burner. That's why you need someone that's at home to make sure that they're not leaving the burners on or leaving things on that need to be turned off. In the moderate stage, they may have more difficulty with just simple math problems. They may have more difficulty just following directions, maybe following a recipe. And they also may forget like phone numbers and just simple information and facts that they previously had. And they also may forget that they had breakfast or they had lunch. They're just forgetting meals and just forgetting a lot more things throughout the day. So when someone's experiencing moderate dementia, they're having more of these more obvious signs. But I have a ton of patients that I see on a regular basis at the hospital that you wouldn't even think that they have moderate dementia. A lot of times these people just seem like everything is going normal. They're functioning completely normal. You do a simple problem solving test and they fail it, and you're just like shocked and surprised because everything just seems totally normal about their cognition. Now, when they have moderate dementia, they're still doing their daily activities. They can still normally get dressed on their own, bathe themselves. They may be able to cook for themselves, doing simple meals, microwave meals, but meal planning is going to be a challenge. Going to the grocery store and trying to remember meals throughout the week is going to be a challenge. So that's why they need a little bit more supervision. They can still pretty much function on their own, but it's safest if they have someone with them. So the last stage of dementia is stage 3. This is like the severe dementia stage. This is when a person they're going to be needing 24-hour supervision. They may need assistance getting dressed, bathing, any meal preparation. They're going to need help with their grocery shopping. They need someone with them all the time to make sure that they're safe, that they can do their daily activities. This is the stage where people start getting lost. Sometimes they'll leave the house. They may sundown. They may have increased agitation at times. A lot of times if these people go to like an unfamiliar environment, like a hospital, they can become very agitated and confused. They can get very angry and hostile with some of the workers. This is the stage when you kind of really need to be hands-on and just kind of be there every minute of the day to make sure that they're that they're safe. In this stage, you'll notice that they have major changes to their personality and behavior. They may not act the same way, they may not do the same things, and it can be drastically different. They may have mood swings a lot more. They may seem a little bit like more bipolar. And in this stage, this is where they completely forget people's names. They may even forget like who their children are when they're at the more severe stages of this end stage. And with severe dementia, it can be very challenging helping these patients just with their day-to-day routines. And you kind of have to treat these patients a lot more with redirecting them a lot throughout the day rather than like telling them what to do. Because a lot of their processing is diminished, they need more redirection to kind of help them to get through the day. I had a patient one time where I was trying to help get her out of bed so we could start working on ambulation and walking. And she was in a lot of pain because she had a hip fracture. So when I got her out of bed, she just kept refusing. She didn't want to do anything because she was having so much pain. But when I redirected and said, let's go to the bathroom, I just want to help you get to the bathroom. That's when like her whole attitude and behavior changed because that suddenly became like purposeful to her. So these people with severe dementia, they need redirection to give them more purpose. So if you can provide an outlet that provides purpose for them, then it's going to be a lot easier to direct them to those things that you want them to do, like getting dressed on their own or toileting or bathing, to help them to be able to kind of stay in a less hostile state. Okay, so now that you know the 3 stages of dementia, let's just quickly go through the 7 stages of dementia. I'm just going to kind of briefly go over this because you kind of already understand the basics. So stage 1 is going to be normal cognitive functioning. There's not really any impairment. You don't really notice anything. They're just a little more forgetful. Stage 2 is unable to recall loved one's name. It still may not even seem like it's dementia. It may just seem like age-related. And in these mild stages, this is pretty much 40% of people that are 65 and older. They may not have dementia, but they may have some of this mild memory loss. Okay, now dementia stage 3, this is where things start to get real and become a lot more obvious. These people are forgetting to go to their appointments, they're losing things, and they're getting lost where they're traveling. Their work performance is not that good anymore. They're just having a lot harder time problem solving. Their verbal repetition is not so great. They're having challenges with concentrating and just any complex task and problem solving. So this is where you really start to notice these changes. Now, stage 4 is even more in this moderate cognitive impairment state where people are starting to withdraw socially. They become a little bit more moody, a little bit more emotional. They're starting to forget these recent events. They're having trouble with just a routine task like preparing a meal or something like that. Now, stage 5 is moderate to severe, so they're right at the borderline to severe dementia. Now, these people are having pronounced memory loss. They can start to wander around the house. They're not safe to be alone on their own. They are disoriented. They start to sundown. They become more agitated, and then they just don't have the mental acuity like they had before. Now, stage 6 is going to be severe cognitive deficits. This is where they're having difficulty sleeping. They may be awake all night long sometimes, and they can get agitated. This can be a huge burden for the caregiver because they're awake all night. They may have personality changes, paranoia, delusions, hallucinations. They're not able to do their daily tasks. They can't get dressed on their own. They can't bathe themselves on their own. They need constant supervision or maybe minimal assistance with their daily activities. In this stage, they may not even recognize their loved ones, their family members, and they can't process things like they used to be. Okay, stage 7 is the last stage of dementia. A lot of people don't even get to this stage. And when you're in stage 7, you start to lose the ability to speak. You don't have physical coordination or the ability to move without assistance. They may require moderate to maximum assistance just to get out of bed, to get on the toilet. Their motor control is significantly impaired. Stage 7, a lot of people don't even live to this stage because there's so much impairments with their physical functioning, and they're not able to process a lot. They become a lot more agitated. This is the last stage of dementia. Now, there are lots of different types of dementia, so not everyone's going to fit perfectly in these categories. There's Alzheimer's dementia, there's vascular dementia, Lewy body dementia, and then frontotemporal dementia. I'll put a link in the description below if you're more interested in learning more about that. And what any caregiver or any loved one should do for someone who has dementia is you need to start setting up a plan, and you need to start quickly. The mild stages, they probably aren't going to need that much supervision, but once you hit the moderate stages, after about 7 years or so, that's when you need to start setting up a plan. These people are going to need 24-hour supervision until the rest of their lives. They should not be on the road. They shouldn't be driving. Some of these patients will benefit from like a memory care unit that they could stay in, or assisted living. And it's better to start earlier than later, because if you have mild dementia and you know that things are going to start progressing, it's better for them to be in a familiar environment like a memory care unit or assisted living, where they are familiar with the people and the staff, rather than throwing this loved one in when they have severe dementia into like an assisted living facility where they don't recognize these people. They're not comfortable there, and it just increases their agitation level, and the people there aren't really adequately they're not able to assist these patients because they're sundowning and they become so agitated and they're not familiar to them at all. When they're in these moderate to severe stages of dementia, it's not the best option to transition to a care facility. It's best when they're in the mild to moderate stages, so it's not a huge transition for them. Now, another way around this is you can hire a caregiver at home to kind of assist the patients. This can be a lot easier and a lot less shocking to the person, rather than having them transfer to a whole new facility, because you want them to be surrounded with things that they're familiar with. If they do go to a hospital, if they go to another facility, you want to make sure that there is something there that helps them feel at home, whether that's pictures on the wall, pictures of loved ones. You can have their cat, a picture of their cat or their dog on the wall. That can actually be helpful. It's also helpful to post a note on the wall that says where they are, why they're there, and letting them know that they're safe. This can just have a huge impact on someone that has dementia, so they're not constantly getting out of bed and asking staff what's going on, why am I here. It just kind of helps them feel a little bit more safe. Now, I actually do a cognitive screening. If you are interested in that, I'll put that in the link in the description below for anyone who has dementia or any cognitive impairment. In the last few years, I've really found an interest in cognitive screening because it's so underused in healthcare, in a hospital, in a physician's clinic, and there's so many people that are just not diagnosed, or they're not getting the care that they receive because a lot of times people don't know that they have dementia. And I think it can be really challenging for their caregivers to be dealing with someone that has dementia and not having a proper diagnosis. A lot of times there's so many doctors right now that aren't taking people's license away when they shouldn't be on the road. They shouldn't be driving. A lot of these patients are going home without any caregiver. And the problem with that is these people can easily fall at home. They can get lost. They can get in a car accident. There's so many dangers with dealing with dementia on your own. And so that's why it's become a huge interest to me recently. And if you're interested in that, definitely subscribe, because I'm going to talk about this more in future videos. And I really want to know what you think on how you can help people with these moderate to severe stages of dementia, because my main thing is just redirecting patients, but I think that there's a lot of other people that may have some other ways to improve that, or to help people that might be agitated with dementia, and what can kind of be helpful in healthcare. So anyway, I hope you like this video. Please like, subscribe, and I'll see you in the next one, and I hope you have a great day. Thanks.